Hello everyone. Today we are going to discuss an important postpartum condition called subinvolution. This condition can affect the recovery process after childbirth and may lead to complication if not recognized and treated early. Let's understand what is it, its causes, clinical features and how it can be managed effectively. First, what is subinvolution or what do you mean by subinvolution? Subinvolution refers to a delay or failure in the uterus returning to its pre-pregnancy size and condition following the childbirth. So subinvolution means after the pregnancy or after the delivery, the failure of the uterus shrinking or back to its normal pre-pregnant size and shape or state. Normally, the uterus begins to contract and reduce in size immediately after the childbirth and continues over several weeks. But in subinvolution or in this condition, this process is either slowed down or completely failed. So, moving to the causes of subinvolution, they can be divided into two: predisposing factors and aggravating factors. So, moving to the predisposing factors, first one is the grand multiparity. What do you mean by grand multiparity? When a woman has had multiple previous deliveries, the uterine muscles may become weak and less effective in contracting. Next one is the overdistension of the uterus, or that means this happen in cases like multiple pregnancy like twins or triplets, or due to amniotic fluid, excess of amniotic fluid like hydromenose. Then poor maternal health or nutritional status. That means the mother may have general health is poor, or anemia or malnutrition can affect the healing or recovery process. Next one is the delivery through cesarean section. In the cesarean section, the uterus might take longer to recover due to surgical intervention. Then next one is the uterine prolapse. In uterine prolapse, when the uterine descends from its normal positions. Then retroversion of the uterus after it re-enters the pelvic cavity. If the uterus tilt backward after delivery, it may interfere with normal involution. Then presence of uterine fibroid. These are non-cancerous growth can hinder the contraction of the uterus. The uterine fibroids are usually non-cancerous, but it what causes hinder the contraction of the uterus back to its normal state or non-pre-pregnant state. Now let's look about the aggravating factors which make subinvolution worse. The retention of placental or fetal tissue inside the uterus. That means the retained products of fetus or placenta or fetal membranes that remain inside the uterus. Then uterine infection, especially endometritis, the infection of the endometrium, which is inflammation or infection of the uterine lining. So these are the causes of subinvolution. Let's move to the clinical features. This can be divided into two: symptoms and signs. So what are the symptoms? Usually heavy or prolonged local discharge, which is the vaginal discharge after the childbirth. Then next one is irregular or excessive postpartum bleeding. PPH, the important topic of OBG, that is postpartum hemorrhage. We will discuss about postpartum hemorrhage in next video. Then next one is the cramping or abdominal pain, especially when retained products or infections are present. Then next one, fever in case of uterine infection. So these are the symptoms of subinvolution. Then what are the signs we can found on physical examination? That is, the uterus remains larger and higher than expected for the stage of postpartum period. The usually on postpartum period, the uterine size slows down or reduces 1.5 centimeter or 1.5 centimeter every day. On day 1 of postpartum, day 2, it may like for example it is 14 centimeter. Then on next postpartum day 3, it may be or 12.5 centimeter or 12. So in this, the sign the uterine remains larger and higher than expected for the stage of postpartum period. Then next one, it may feel soft or boggy upon palpation. On the palpation on physical examination, the uterus feels soft or boggy rather than firm. Usually on postpartum period, the uterus must be firm. Then next one, signs related to underlying causes, example like infections, fibroid or retroversion, may also noticeable during this palpation. So moving to the management. The management of subinvolution involves treating the root cause. So we can look what are the management. If an infection such as endometritis is present, broad spectrum antibiotics should be started immediately. If retained products are suspected, like we said that the fetal membranes or placenta, surgical evacuation of the uterus may be necessary. Then for conditions like uterine prolapse or retroversion, inserting a pessary can help reposition and support the uterus. Then ergometrine or other uterotonic agents may be prescribed to help the uterus contract and reduce blood flow, thus enhancing the involution process. In all cases, supportive care like rest, hydration, nutrition, and monitoring for complication is crucial. So, this is about the management. To sum up, subinvolution is a condition where the uterus fails to return to its normal size after childbirth. It can be caused by multiple factors like infection, retained tissue, uterine abnormalities. So, thank you for listening. Stay tuned for more maternal health topic and don't forget to like, share and subscribe if you found this useful. And comment down which topic do you want to on the next video. Thank you.